For families grappling with conditions like sickle cell anemia, bone marrow transplant offers a beacon of hope. Today we'll be answering the top 10 frequently asked questions about bone marrow transplantation. We'll delve into donor compatibility, the procedure itself, potential risks, and the remarkable impact it can have on a patient's life. Our goal is to address your concerns and shed light on this transformative treatment option. Let's get started. Many parents ask me, is there truly a cure for sickle cell anemia? And the answer is yes. Bone marrow transplantation is the only definitive cure for sickle cell anemia. This procedure involves replacing your child's faulty bone marrow, the source of the disease, with healthy bone marrow from a compatible donor. Imagine those damaged cells, the root of so much pain and suffering, replaced with healthy ones capable of producing normal, functioning red blood cells. This isn't just about managing symptoms, it's about transforming lives. With a successful transplant, children with sickle cell anemia have a greater than 95% chance of being cured. Think about that for a moment, a chance to live a life free from the debilitating pain, the constant hospital visits, the fear of complications. That's the power of bone marrow transplantation. Now you might be wondering, who can be a donor for this life-saving procedure? The answer lies in a critical match, the HLA match. HLA stands for human leukocyte antigen, and it's a group of genes that determine the compatibility between a donor's immune system and the recipient's. You see, our immune systems are incredibly complex. They're designed to attack anything they perceive as foreign. In the case of a bone marrow transplant, we need to ensure that the recipient's body doesn't reject the donor's healthy cells. That's where HLA matching comes in. A close HLA match between the donor and recipient minimizes the risk of rejection, paving the way for a successful transplant. For many families, the search for a compatible donor begins at home, often with siblings. But how do we determine if a sibling is a match? The answer is HLA typing. HLA typing is a specialized blood test that analyzes the HLA genes of both the patient and potential donors, typically siblings. It's like finding a perfect puzzle piece. We need to ensure the HLA genes align as closely as possible. The most accurate HLA typing method is called high-resolution sequence-based typing. This test examines specific regions within the HLA genes, providing a detailed analysis of compatibility. While siblings are the most likely matches, parents can also be tested. The goal is to find the best possible match to ensure the highest chance of transplant success. I often hear concerns from potential donors, particularly parents, about the donation process itself. They ask, will it be painful? Will it have long-term effects? Let me reassure you, donating peripheral blood stem cells, the most common type of bone marrow donation, is a safe and relatively simple procedure. It's very similar to donating blood. The donor is connected to a machine that collects blood stem cells from their bloodstream. The process typically takes 3 to 4 hours, and donors can watch TV, read a book, or simply relax during the donation. Most donors experience minimal discomfort, usually some mild fatigue or bruising at the needle site. Importantly, the body replenishes the donated stem cells within a few weeks, and there are no long-term health consequences. In many Western countries, the price tag can be daunting, ranging from $200,000 to $600,000 or more. This cost includes everything from the initial evaluation and testing to the transplant procedure itself, medications, and follow-up care. It's a significant financial burden for families already grappling with the emotional and physical toll of a serious illness. However, Bone Marrow Transplantation Ghana offer bone marrow transplantation at a fraction of the cost, with no compromise on quality of care. By utilizing less expensive yet equally effective medications and streamlining the treatment process, they've been able to significantly reduce the financial burden on families. In the past, finding a perfect HLA match was essential for a successful bone marrow transplant. But what if a perfect match isn't available within the family? That's where haploidentical bone marrow transplantation offers new hope. This groundbreaking procedure allows a half-matched donor, most often a parent, to donate bone marrow or blood stem cells to their child. Yes, you heard that right. A parent can be a donor, even if they are not a perfect HLA match. This is particularly significant for mothers who are often highly motivated to help their children. Haploidentical transplantation expands the pool of potential donors, giving more families a chance at a cure. Once a compatible donor is identified, it's natural to want to proceed with the transplant as quickly as possible. However, there are crucial steps involved in preparing the patient for this complex procedure. This preparation phase is called downstaging, and it involves a comprehensive evaluation of the patient's overall health. We need to ensure that their body is strong enough to withstand the transplant and minimize the risk of complications. This may involve treating any underlying infections, addressing nutritional deficiencies, or managing existing medical conditions. The downstaging process can take a few weeks to a year, depending on the individual patient's needs. You might be wondering, how can BMT Ghana offer bone marrow transplantation at such a reduced cost without compromising on quality? The answer lies in their innovative approach to treatment. First and foremost, they prioritize patient preparation. By ensuring that patients are in optimal health before the transplant, they minimize the risk of complications, which can be costly to treat. Second, they utilize less expensive yet equally effective medications, such as oral busulfan, for conditioning before the transplant. This significantly reduces the overall cost of treatment. Finally, their team of dedicated physicians is driven by a passion for healing, not profit. They've created a streamlined, efficient system that eliminates unnecessary expenses, making hope affordable for families in need. After undergoing a bone marrow transplant, patients remain in the hospital for a period of recovery and close monitoring. The average hospital stay after a bone marrow transplant is about 45 days. During this time, the medical team closely monitors the patient for any signs of complications, such as infection, graft versus host disease, or organ damage. They also provide supportive care, including medications, blood transfusions, and nutritional support. The length of hospital stay can vary depending on the individual patient's recovery progress. Factors that can influence the duration include the type of transplant, the patient's overall health, and the presence of any complications. One of the most significant milestones after a bone marrow transplant is achieving transfusion independence. This means that the patient's bone marrow is producing enough healthy blood cells on its own, eliminating the need for regular blood transfusions. Most children who undergo bone marrow transplantation achieve transfusion independence within a month after the procedure. However, the timeline can vary, especially in cases where the donor and recipient have different blood types. Regular checkups are crucial during the first year after transplantation to monitor the patient's progress, adjust medications as needed, and address any concerns that may arise. With proper care and follow-up, patients can go on to live full and active lives. Thank you for joining me on this journey to understand bone marrow transplantation. We've covered a lot of ground, from the science behind HLA matching to the emotional aspects of being a donor or recipient. We hope this guide has answered your questions, addressed your concerns, and provided valuable insights into this life-changing procedure. Remember, the more you know about bone marrow transplantation, the better equipped you'll be to make informed decisions about your health or the health of your loved ones. If you're considering bone marrow transplantation, we encourage you to reach out to a qualified healthcare professional to discuss your specific situation.